All right, welcome back. Happy New Year again, everyone. We're here once again with Jen Bowman from the Rockford Valley Blood Center. Now, we also were talking about kind of being scared of needles and kind of getting over that fear. What kind of benefit, though, do you see when you come in as a blood donor? How do you, what kind of benefit is there?
You know, that's one of the hardest things about donating blood, because you don't get to see the person that receives your unit of blood. But we do have a cool system now at the Rockford Valley Blood Center where a few days after your donation, you're going to receive a call, and it's tied to you directly. So it's not like this blanket call that goes out to everyone, and it will tell you on your voicemail, if you don't answer, your unit of blood that you donated on this date was sent for a patient at OSF St. Anthony Medical Center.
Really?
Yes. Or
That's
Rockford
so cool.
Memorial, or Swedish
Wow.
American, or Beloit Health System. And so I think that's kind of cool, because then people are like, oh my God, it went there. And
it's like tracking a package in the mail, like you're
exactly.
tracking your own blood.
And you know, there's a lot of confidentiality involved with donors and patients and things like that. So a lot of time you don't know who you're helping, but if you do a little research just by going out and asking people, you'll find out that more people than you think have had blood transfusions. And you know, you don't hear about it as many with young people, because usually with young people it's either a trauma, a surgery, or cancer. But you know, hip replacements, knee replacements, all those kind of things that you see, you know, the baby boomer generation going through every single day. There's blood needed for those type of things. There's some, you know, different conditions like sickle cell where they have to get transfusions their entire life just to stay alive and live some sort of quality of life. But it's, you know, it doesn't have all the bells and whistles of, you know, a tragic accident or a national disaster and things like that. And that's what we try to explain to people is it just has to be there when things happen. And it's been so long, but I go back to, we were one of 15 blood centers throughout the country that were able to assist on 9/11. And that's because long before 9/11 happened, in the weeks and months leading up to that, people had come and donated blood, and we had enough sitting, typed, ready on the shelves, already tested, that we could send that to New York Blood Center to assist.
That's amazing.
And,
that's
you know,
so great.
If you know, we had thousands of people come in after 9/11 happened to donate, but it was the people that came in beforehand when there was no inkling of what was going to happen that day, and those were the real heroes, because they came in not because of some specific reason, but just because they knew it does get used. And people always wonder, we do not throw blood away. 0.01% of the blood supply is discarded from the Rock River Valley Blood Center, and that's usually due to some sort of manufacturing technical error. Okay. The blood is used. If we can't use it here locally, there's a national blood exchange where people are on all day saying, we don't have enough of this type. Do you have some of this, or do you need more of this?
Good. So your time and your donation will never go to waste.
Oh, no, no, no. There's just not enough of it for us to take any of it for granted. So, and with computers, it's easy for us to communicate with a blood center in San Francisco, or Texas, or, you know, people that have snowstorms when we're not having them. They may not be able to have mobile blood drives, or staff can't get to work, or donors can't get to donate. And so there is a little bit of a gentleman's kind of camaraderie that we help each other, and that's really important too, because you know, we're there to help people, and then they're there to back us up if we ever need it as well. Sure.
Now, we were mentioning right before we went to break, there's this new focus in January. January is kind of like a special month for you guys, right?
It is. I know everybody has a month now, but January has been for many, many years National Blood Donor Month. And January was chosen for many reasons. One, it's very challenging for us to collect blood in January. Once all this holiday stuff is over, everyone tries to get back into stuff, and they just get real busy again. And it gets cold and the weather, and accidents still happen. So we try to get people to remember to come in. But it's really a month to celebrate all the people that do come in, while also encouraging them to get their friends to come in, their family to come in, because donors are our best advocates. They can really say, this is how it goes. You know, I can talk till I'm blue in the face, but I work there. So they trust people that just come in to know that, you know, it's a really easy process. It's kind of technical. We ask a lot of questions and things like that, but that's for safety's sake. And as any one of us could turn around and go from being a donor to a patient, we always want to know that things are very safe. And like I said before, we take every measure we can to make sure that everything is used in the most efficient manner ever.
Yeah, I think the questioning is a good idea. I mean, if I were receiving blood, I know I would want to make sure that somebody answered all those questions.
Oh yeah,
you know,
and the blood supply is safer than it's ever been.
Good.
And you know, the beauty of things now is that, you know, blood is usually needed when things are really bad. It's a basis of survival. Yeah. So if it's the point where you need a blood transfusion, you shouldn't have to worry about, is this blood product safe? But the testing is so specific and so high level testing is done. It's nucleic acid testing is done, and you have a 1 in 2 million chance of contracting something ever from a transfusion. So your likelihood of many other really bizarre things like getting struck by lightning are much more likely to happen. So the blood supply is very, very safe, and that's beautiful because medical technology has allowed that to happen.
That's great. I mean, it literally saves lives just every single day.
And the best thing for us is when we'll get a mother or a child or someone will come into the blood center and say, thank you, I'm here today because of that. But I know that personally because my dad was a recipient of over 100 products of blood.
Wow.
And he is around today to see his granddaughter on Christmas, and he beat leukemia, and he beat leukemia because of platelet and blood donors.
That's great. Is that why you got involved in all this, or were you already working at the blood bank?
Nope, my dad was sick and I was working in radio, and luckily the people that own the radio stations here in town, they were willing to let me kind of get on my soapbox and make a cause out of it, because I didn't understand until my dad got sick. I had no idea. I donated blood in high school, but I just didn't really get to where it went.
Yeah.
Or who needed it. And I never thought like one person could get 100 units of blood, or what a platelet was, or any of that stuff. And it really did become a passion in my life. And the bone marrow program, the blood donation in organs and tissues, and all the stuff that we work with down at the blood center has really become something that is ingrained in me now. I can't make it go away. So
yeah, every time I see you, every time I talk to you, it always comes up. So,
yeah, it's kind of weird. I'm sure people get sick of it. My friends are probably sick of me.
That's great. I mean, I can't think of a better passion to have.
No, and it's nice when you do what you love. It makes work a lot more fun too.
Yes.
And I can see, when I go see my dad, anytime I see my dad, I realize it really does work. And we meet kids all the time that have been saved through blood transfusions and marrow transplants and things like that. And to know that anyone has one more day to live because of a blood donor or a marrow donor or an organ donor is awesome to me.
It's huge. It's huge. Now, you mentioned you have a lot of blood drives, and there's one that's coming up this Tuesday if people are interested, right?
Yep. We'll be out at Freeport Memorial Hospital out at the FHN campus. It'll be in the lower level, but there'll be little signs all over if you drive in there.
Okay.
There's little arrows that say blood drive, and all our kind of goofy stuff we put around. There'll be some A-frame signs, and usually there's signs that are saying, come this way, and FHN has stuff up too. So that's a great way, especially if you're out in the Western Corridor, stop on by. And I think it's kind of fun sometimes to donate at hospitals, because you're there with the people that actually use these products, and talk about a great place to get a story. Ask a nurse that works in an ER, how important is blood. Because when they call for it, it better be there, because they need it to get through the next, half hour.
There's no time. You can't then go find somebody to give blood because we need some right now.
So we try to help doctors and nurses help save lives, and that's kind of, we stand in the background and try to be a support system as best we can.
That's huge. So again, that one is at FHN. It's on the lower level of the hospital, right? And it starts at 10:15, which is very specific.
Yes,
but
I know.
like it.
I'm not sure why, but it does.
And it goes from 10:15 till 3. So this is great, because whenever your lunch break is, you can just kind of head over there on your lunch break, right?
Head out there and support FHN. They want to collect as much blood, and they're very proud of all the efforts they do. And at any time you can go to our website. However, I will say we are doing a conversion right now, and it's not working exactly as I would like it. So if you do check the website and it's not working that well, it will be working better soon. But you can also always call us toll free, 877-RRVBC99. And like I said before, tell us where you live, where you work, where you're sitting at soccer practice, and we'll find a place that you might be able to donate at that's convenient for you.
Make it as easy as possible. We're out of time. It goes so fast whenever you come. We're going to have that phone number, though, and the website for you again right after the break. So grab a pen and paper. We'll be right back.